Saaghe Fogwe podcast. Elevate your life, empowering insights for growth, success, and fulfillment.
Hello, everybody, and welcome to the Saaghe Fogwe podcast. I am super excited about today. Welcome to everyone who's joining us. If you are just joining us for the first time, make sure you're liking the video, subscribing, sharing to others. If you're already subscribed, make sure you're sharing the link with others. We will not go too far into the show before sharing the link because we've had feedback about people who don't want to join when we've already started speaking a whole lot. So we'll go ahead and share. Before I even introduce my guest right now, I want to go ahead and start sharing the link so that we can have people jumping on here before we go into the conversation. So I'm going to do that real quick. So if you're joining, just get set up and be ready for a wonderful show today. I'm going to share here so we can get people. So get your pens ready to take some notes because it's going to be a wonderful one. So I shared with you.
Okay.
Yeah. It's going to be a great one today, guys. So make sure you're inviting others to join us. So we're doing it a little differently here. Normally we speak for a little bit and then, start sharing, but I'm listening to the audience and we're going to try this out and see if we get more people to jump on. Okay. Here. Okay, keep sharing, guys. Keep sharing the link. Okay, let's see. A couple more shares here, and then we'll go right into it. All right. Once again, welcome everybody. Like every other show, this one is super special. And the reason it's special is because of the topic. We're talking about men's health today. This is a topic that a lot of people, we kind of shy away from men's health, especially those in primary care. We deal with women, we deal with kids, but we don't always focus on the men's health so much. But today we will be zooming into that, talking about men's health, especially testosterone. I do have some classmates who already were like shocked. They had the shocked look like, you're going to talk about what on the air? Are you serious? Yes, I'm talking about testosterone today, or we're talking about it. But I can't do it by myself. So I brought someone here who's a friend, a colleague. He's an expert in this topic. And we'll get to know him a little bit and then talk more about this topic. He's a physician assistant. He's a family man, very knowledgeable on this topic. So I'm going to invite no other person than Mr. Nelson Chukwuelue.
Thank you.
Did I butcher it?
Kind of.
Okay,
cool.
please.
I'm used to it. Yeah.
Say it the right way.
Chukwuelue.
Chukwuelue.
Yeah.
Okay.
Chukwuelue.
Chukwuelue. Okay,
Yeah.
I butchered his name.
No,
Sorry.
it's okay.
I'm paying back for my name being butchered all the time. All right, welcome, sir.
Thank
it's
you.
really good
Thank
to
you.
have you here.
Thanks
Yeah.
for having me.
Yeah. So tell people a little bit before we go into the topic. Let's know who Nelson is.
Okay.
A little bit your background, where you're from, what
Okay.
you're about, family, all that stuff, so that
All
we
right.
get to know that you're a real person. You're not just a robot sitting here,
All right. Well, my name is Nelson Chukwuelue. I'm a physician assistant. I'm currently practicing at the Loti Center in Mansfield, Texas. Went to PA school at Texas Tech and did my undergrad.
Oh, we're both Red Raiders.
Okay,
Did not
Red Raiders,
realize this.
guns
Yes,
up. Yes,
guns
sir.
up.
Yeah,
All right. Okay,
yeah.
I did not know that.
All right. And then did my undergrad at the University of Texas here in Arlington. So, moved to Texas from Nigeria in 1996. So when I was 21, and I've made Texas home since then. So, yeah. and currently reside in Arlington, and with my wife and 2 kids.
All right.
Thank you.
Very brief.
Yeah.
He's not a man of, he's a man of few words. So we're gonna make him talk today. We'll make him talk a little bit more.
Okay.
You know, he's used to like quick
Yeah.
because he deals with men. We're surrounded by men every day, so we get to, we talk fast.
Yeah.
But yeah. So what got you into men's health? So how did you end up with men's health?
So initially, the initial attraction to men's health was the fact that Low T Center, which Low T Center, whereas the first place I worked at Men's Health, the only place I've worked at as well, promote wellness, health, and fitness in men, and it's something I'm passionate about. So our values aligned, and so that's the main attraction. But the main thing that's kept me working in men's health is seeing the outcome. Seeing patients from day one, how they come into the clinic dejected, head down, mood down, to doing the treatment after a few weeks to a few months. You see the transformation in these guys. And that's what keeps me there. Yeah. It
makes a difference. Yes,
absolutely.
It makes a big difference. I'm just seeing that transformation,
Absolutely.
seeing people go through. But we'll back up a little bit because
Okay.
we're already, kind of getting into the conversation here.
Yeah.
But so how long have you been in men's health? Just to give us
10 years.
10 years.
A little over
Okay.
10 years
So
now.
with Low T.
Yeah, with Low T Center.
Yeah.
Absolutely.
So he's a vet.
Yeah.
He's a vet in men's health.
I guess.
So give us before we go into the conversation about testosterone specifically, give us the difference between what primary care, because in primary care, like I started saying, we focus on women, we focus on kids.
Right.
When we're there, we're even scared of the topic of testosterone. I know when you see certain numbers, you're like, oh no, I'm not dealing with that or this, but give us a difference between what, Low T will do for somebody, a man, as opposed to primary care.
Yeah, I think the main issue is it's not like primary care doctors can't treat, or primary care physicians, providers can't treat Low T. It's the fact that men shy away from going to the doctor as a whole. Also, the providers in primary care, Low T or low testosterone is not something that's taught in med school. So a lot of the providers don't come out with like a guideline on how to treat low testosterone like they do with diabetes, hypertension, and high cholesterol. So so at Low T centers, we're specialized in treating men's health and low testosterone. It's what we do, and we do it real well because we're basically specialized in doing that. So
So it's the same, like someone who's a neurologist is very specific. They know what they're doing,
Exactly.
and they'll zoom in on the problem better as opposed to primary care, ER. We throw everything on the wall and see what sticks.
Exactly. So it's like I said, it's what we do. It's what we specialize in, and we do it real well. Yeah.
Give us a reason why any guy should even walk into a Low T center to get checked. Why would they need to check that? And what age group should we be looking at?
Yeah, usually the decline in testosterone usually happens right around age 30. So I tell patients around that age to just check your T levels, just to get that knowledge, have that knowledge. But above all that, more importantly, the testosterone value in itself doesn't really mean anything unless you're symptomatic. So know your numbers, but then if you're symptomatic, act upon it if you wish. And
what symptoms would people look for?
Primarily, when you talk about testosterone, people automatically think sexual health, sex. So it's more than that. It's the guy who has mood swings, grumpy all the time. There's a guy who gets home from work, sits on the couch, doesn't want to do anything. There's a guy who has had many hobbies, and and recreational activities in the past, and now don't feel like doing them anymore. So those are the signs of low testosterone. And of course, you have the sexual side,
Yeah.
Low sex drive, and erectile dysfunction and whatnot. So
And some have like hot flashes. Some will complain of hot flashes and things like that because the hormones are in.
And also there's
balanced.
also decline in mental clarity
Yes.
as well. So that's and muscle mass and bunch of symptoms.
So with those symptoms, you have those symptoms, because most people will go, again, I keep going back to primary care because I came from primary care, and I still kind of, do primary care in some ways, but most people will check your labs, will check your regular labs, and then nothing, and then they go home and sit at home. So what we're really saying here is that people should think outside of that, especially if you're above the age of 30. You should be thinking that maybe it has to do with your testosterone level and get checked.
Absolutely.
So I walk into low T. What next? What happens to me?
Okay, when you walk in the first time, that's what you're saying. So you walk in the first time, we will have you fill out some forms, of course, on a tablet, on paper, sign some consent forms, and on the very first visit, we'll get a vial of blood, and we will run your testosterone levels in-house. It takes about 15 to 20 minutes after the blood is drawn to get results, and we'll let you know where you stand. And that's what to expect. An average visit would take about 30 to 40 minutes.
And low T centers are all over the place, by the way, guys. So so you at the end we'll share the website so you can see where how to get on there. But as much as we're talking about low T, I want people to understand that we're also just educating on the topic of testosterone for people who are not even around around this area. So we shouldn't think that we're only focused on who we work for, but we're actually educating on the topic. So so we're doing two things here. We're talking about where we work, but we also are educating on this topic. So they walk in, first visit, we check the levels. You're low. What does low mean? Like, what is a low level?
Typically, low means having a total testosterone level of less than 349 or less. Okay, based on our scale, based on many skills. Now, sometimes we have situations where a patient comes in and the total testosterone, the patient's symptomatic, and the total testosterone is normal. Okay, so in those cases, we have to run an additional test to figure out what your free testosterone levels is. We run a test called a SHBG, or sex hormone binding globulin. This is a protein that binds your testosterone and leaves a small amount of testosterone free and available for you to use. So we do that calculation with that test and determine if your free testosterone levels are low. If your free testosterone levels are low, you have low testosterone. So.
Okay, and then we need a second visit. So after the first visit, we need a second visit. What do we do on that second visit?
So on the second time, and the reason why we need a second visit is because testosterone levels fluctuate. So each day you're going to be up and down. So we need two low testosterone levels to make the diagnosis of low testosterone or hypogonadism. So we'll have you come back the second time, of course, and it's same kind of situation, some paperwork involved, and
and men hate paperwork.
we try to keep it streamlined. We try to keep it streamlined. It's a necessary paperwork. But we try to keep it streamlined, and we get a second set of labs. We run a second set of testosterone. At this visit, we also check your prostate levels. Okay, we need to make sure your prostate levels are normal before we can start you on testosterone treatment. Okay.
No, I was going to ask because I'm sure people are wondering why do they need to know about their prostate health? Because it's like
So we need to get the prostate levels checked, just because testosterone, if you had an issue with your prostate, like prostate cancer or whatnot, so in some cases testosterone treatment can make it worse. So we want to make sure we're not doing any harm. We want to make sure there's no prostate cancer or anything of that sort going on before we get you on testosterone treatment. Yeah.
And we've had some cases where, the levels are out of norm, but
Yeah.
we still get some clearance from urology. So
Yeah.
we send them off.
Yeah.
And if you get that clearance from a urologist, and then we can still get you treated, because in that case,
Yeah.
if it's not cancerous, obviously
Yeah.
we still manage the care.
Absolutely.
And so the second visit, elaborate a little bit
Okay.
more on that second visit.
And back to the issue of
Yeah.
PSA and prostate cancer. We've had patients, again, men don't like going to doctors. We've had patients who never go to doctor's offices come get testosterone levels checked because they care about testosterone. And then we find out this patient has high PSA levels, which has, in many cases turned out to be prostate cancer. So in that we've, caught a bunch of prostate cancers in men through that, doing this screening test we do. So yeah. So back to the second test, the second day. So we get your testosterone PSA levels. If the testosterone levels are low and prostate's normal, we can then start you on testosterone treatment. Okay. From the blood drawn on the second day, we are going to screen for not just low testosterone. We check your kidney function, your liver function, your electrolytes, vitamin D levels, cholesterol, diabetes, and your thyroid. So for guys who typically don't go to their regular doctors, they can get that.
We have to drag them across the floor.
They can get that test from us once a year. Yes.
Yeah. So why are we checking all of this? You're treating testosterone. So why are we checking all these? We gotta
make sure the guy's healthy. Yeah, we gotta make sure there's nothing else going on. Yeah.
And what happens with these labs that we're checking? Yeah.
We go over the labs with the patient, just if there's anything wrong. In some cases, we can address those issues. And sometimes we just have them go see a primary care physician or a specialist. Depends on what comes up on the labs.
Yeah, and this is one thing that really attracted me too. And I know you mentioned that about the the holistic care. Walking into a place, because you think that they're just focused on one thing, right? And then you see that, hey, we really care about more than just giving you that testosterone. And we'll talk about how the treatments are done as well. But for me, that was a big deal, because you're looking. Yes, it's hard to get men to the doctor. You found the one thing that they're interested in, or that they come for, and then at that point you're still able to manage a lot more than just replacing this hormone that they're missing.
Absolutely.
So the one question I wanted to ask was that went away from me. I'll come back to it. I'll put a pin on it. I'll come back to that question. But apart from, yes, we talked about testosterone. We do the level. We do that first visit. You do the second visit. We do that big panel of labs, and we're checking on their wellness.
Right.
What outside of that? So how do we start the treatment with this patient? So this patient has gone through. They've done the second visit.
Right.
Now they want to start therapy. How do they get about starting therapy with you?
Yeah, we start them on we just start them on therapy on testosterone injections if they wish to, of course. The patient has to want to do it. In some cases, we have patients who go through the whole process and don't
decide not to.
Yeah.
They just want to know their level.
But we give the patients injections in the office usually, and it's usually a once a week dosing regimen. And we have them come back we do serial testing. So you start the injections, and after 6 weeks of being on the injections, we test you to see where you are, where your levels are, and see if we need to make any adjustments to your dosage. And we keep doing the shots, and 6 weeks after that, we do another testing to see where you are, and also look for side effects of testosterone treatments. Yeah, which can happen. Yeah.
Okay. What are some of these side effects? Because we do have to
so some of the side
not
effects,
to scare people, but we have to, we have to mention
some of the side effects guys can run into. Mostly just some guys will break out with acne in the back and shoulders. It can cause some mild water retention, so hands and swelling your ankles, which there's all things that, of course, it's nothing too serious, things we can mitigate and manage, in clinic. And And of course, we check for prostate cancer every 6 months while on
Mm-hmm.
testosterone treatment. And we're also going to check your red blood cell count too. Testosterone injections has a tendency of making your body produce more red blood cells,
Mm-hmm.
more your hematocrit levels might go
Yeah.
up higher. And in those cases, we just have you do blood donations or just dump some blood out, which we can do in house as well
Yeah.
for guys who want the convenience.
Yeah.
Yeah.
Yeah. And I know we've talked a little bit about why people come in. Let's elaborate on the benefits of having this therapy. Like you kind of talked about some of it, like how
Yeah.
people feel at the end. So just
Yeah.
elaborate a little bit more on
Yeah.
the benefits of
Oh yeah.
replacement.
There's a lot of benefits to testosterone treatment. Again, we talked about not just the sexual side.
Mhm.
It's having the energy levels.
Mhm.
Majority of our patients come in there because they're, you know, they have real fatigue, low energy. That's the driving force that brings a lot of guys in there. Then we also have the mood issues,
Mhm.
yeah. So guys with mild depression, mild anxiety that have improved with
Mhm.
testosterone, and yeah, and we get guys who, of course, losing muscle mass
Yeah.
and increased body fat. So testosterone can improve all those things.
And they'll work out better. You see
Work
them,
out
you see
better
people
results.
working
Yeah,
out, the more
yeah.
energy to
So
work
so
out.
basically,
Mhm.
just improve quality of life.
Yeah.
Yeah, with testosterone treatment.
So we're saving marriages,
Saving marriages. Yeah,
saving
yeah. Saving
relationships, because you
relationships.
might
Yeah,
just be in a relationship and you don't even know
yeah,
why this person is moody
yeah.
all the time,
Exactly.
or they're snapping
Exactly.
at you all the
Exactly.
time, and it
Exactly.
could be as simple as your
Yeah.
testosterone
And
level.
saving lives,
Yeah.
because a sedentary lifestyle
Mhm.
can lead to an early grave. So
Yeah.
yeah, testosterone treatment would get you the energy levels to get out there and just do more, yeah,
Yeah.
and enjoy life. So
Yeah.
yeah,
And we talked about in clinic, but we have the option to for those
yeah,
who don't want to keep coming to the clinic to
yeah,
get
yeah,
we
yeah.
have that option to do it at home. So talk a little bit more
Yeah,
about
so we
that.
also offer self-inject for patients who prefer to do the shots from home, most likely due to their schedules.
Yes.
Yeah, so we can have them do the shots at home. We have a pharmacy that mails them a shipment with a pack of injections, and they just do the shots from home. We require that it come in for labs periodically as well. The monitoring very important when it comes to testosterone.
Yeah,
Yeah.
and I mean, if you can't do it yourself, you might have, a spouse
Spouse, yeah,
and
yeah.
I've joked with the guys. I'm like, don't make your wife mad now, because they might stab you. No, I'm just kidding. poking poking the wrong spot. No, I'm just kidding. But yeah, so you can do the self inject. But we still monitor we still
Very,
have they
very
still have to
important.
come
Very
back
important.
and
Yeah.
and monitor their labs is
Yeah.
very important.
Yeah.
Because I've had some of them, when we talk about the prostate, they think that we're going to do the physical prostate
prostate
examination.
exam,
I'm like,
yeah.
nobody wants to do all that. Sorry, we're not doing that. It's just blood work, just a
Yeah.
little vial of blood. We're not doing a physical exam
No,
of the
no prostate
prostate. So
checks. Yeah.
no.
Yeah. We reserve
Yeah.
that for the urologists.
Yes. And we work very closely with urologists too,
Right.
because we have to send a lot of the patients there to get cleared. And, those who have BPH, or benign prostate hypertrophy.
Yeah.
Yeah. So we send them to get cleared. So we work with
Yeah.
urologists a lot
Closely.
on that. Talk about the extra things that we do. We talked about overall wellness.
Yeah.
There are other things that we do outside. So once we get people established on therapy,
Testosterone, yeah.
what are those other things? Just talk a
Yeah.
little bit more about the extra
So
things.
we also offer medications and remedies for weight loss. We now offer peptides for growth hormone,
Mhm.
and offer other remedies for that anti-aging.
Yeah.
So so we offer a bunch of other services, but to find out more, I guess go to Loti
Loti
Center,
Center.
book an appointment, come talk to us, and
And we'll talk more about it.
we'll
It
give
depends
you,
on what you need,
yeah,
right?
we'll
So
give you, yeah,
yes.
yeah, yeah.
Yeah.
Anything to improve your quality of life, we have them. Yeah, we offer those.
Because the way the way it works is it's a finely tuned machine, and
Right.
if one faction isn't working, because we usually we tell the guys, it's not just about that replacement, you getting that hormone replaced. You want to make sure your diet is good.
Right.
You want to make sure
Lifestyle.
you're exercising. You're not a couch potato just
Right.
laying there
Right.
expecting a magic
Right.
treatment. You know,
Right.
we have to, and lifestyle modification is very
Very
important, and we
important.
talk to them every day about that. And that's,
Absolutely.
again, it makes, I love the holistic
Right.
part of it, where it's not just about that, that additional injection
Yeah.
you're getting to replace your hormones.
Yeah.
You have to do your
some
part.
work. Yeah.
Do your
To get
part.
better results.
Yes, we do ours. But I know that we're focusing on men today,
Yeah.
but we also, because some of the women who I send
Yeah.
the preview to, they're like, so are we just gonna listen about men, or we have a women's clinic too. I know
Yeah.
that's not
Yeah.
your forte, and it's not
Yeah.
mine
Yeah.
either.
Yeah. But we do offer,
Yes.
we have a sister clinic called the Hair Care Center. They offer identical services. So for the females out there, you can go to haircare.com and check that out. Offer, even testosterone treatment in
For
females as
women.
well, and as well as options for weight loss and
And
a whole
women's
bunch of other
health
things.
as well. So
Yeah.
again, women, we're always
Yeah.
we always have to match up, right? But the
Yeah.
hair care is HERKARE.
ARE.
So yeah, it's .com. So her care. So they do women. We do our men. The question that most people will ask is, how long do I have to do TRT?
TRT.
Yeah.
Yeah, I
How
get that.
long?
Yeah. For life. No. When I tell patients, it's testosterone treatment is a chronic thing. So you do it for as long as you want to enjoy the benefits of testosterone. So if you decide to stop in 5 years, after a while, the symptoms you had previously
Will
all
come
going to
back.
come back. So it's something it's basically a lifelong treatment. Yeah, if you want to enjoy the benefits. Yeah. But it's the patient has a choice in this matter. So yeah.
So let's see. Do we have any questions out there? We're going to no questions right now, but let's shout out to a few people here. I see Teku is on. Will is one of the guys who goes around. Will, Will is on. Hi, Will. Diamond is on. Victor is on. Thank you guys for watching. If you have any questions, just drop it in the comments, or just just drop a message on where you're calling from too, or where you're dialing in from, so we can give you a shout out. Yeah, so no questions right now.
Okay.
But speak to the guys who are still hesitant to go to to get this
checked
yeah,
out.
to come get checked out. Just speak to them.
So for anyone who's hesitant about coming in, it's the process it's an easy process. To book an appointment is easy. You can book an appointment today online and get an appointment the next day in most low T centers, or it's an easy process. Testing takes about, when you get one vial of blood the first time you come in, like I said, it takes about 15 to 20 minutes to get your results. It's inexpensive. The test is inexpensive. The initial test cost about $25 to $40, and the treatment itself is affordable as well. Yeah, so it's for any guy out there who's hesitant, it's
and it doesn't hurt anything to find out about what your body is doing, because sometimes it just helps to know that okay, this is I'm normal. You found out out, because we live with these things, and without making the effort to to find out what our body is doing, it doesn't help us in any way. We talked about age 30 and above,
right?
Do we have people below 30 who come in, and what are the risks?
Unfortunately, we have some patients who fall below the 30-year mark. We see patients starting at 24 years old. So our youngest patients are 24 years old. So testosterone levels decline for various reasons. As we age, it declines. Lifestyle can make it decline as well. And also sometimes it's just hereditary. You know, you
Yeah,
just
I was
can't,
gonna ask.
just can't,
Yeah,
yeah,
will
you
we
just can't
have
help it.
genetic?
Yeah,
Yeah.
genetic, yeah,
Mm-hmm.
component to it.
Mm-hmm.
So yeah, so we can treat patients as low as 24 years old. Now, the only downside to being on testosterone at such a young age is because testosterone can also lower your sperm count.
Mm-hmm.
So yeah, long-term use of testosterone can make you infertile.
So if you're planning to have kids, you're
we
still in that.
recommend,
Yeah.
we recommend wait till you have kids, and after that you can have testosterone. But if you choose to, we have remedies to that can help,
Yeah.
mitigate that if you choose to treat. So yeah, there are options.
All right. I told you he was a man of a few words. He said he was not going to do this for an hour. He made sure of that. He ran through this. No questions out there.
Yeah.
Any final thoughts? Because we're going to round this up. It looks like we.
So the only final thought I have is just for as a society and for men to be more open about talking and taking care of their health. We should try to normalize sexual health and mental health. There shouldn't be a stigma or taboo around testosterone treatment. So yeah, so guys out there, just be open. Come get checked out, and don't be shy about getting the treatment you need to improve your life, and in some cases, life of your family. So yeah, those are my.
Yeah. And you mentioned mental health. We're joking about it, but honestly, some people get sent to us by psychiatrists because they've gone there, they've gone through all the psych stuff, and it's not psych.
Absolutely.
It's literally their testosterone that's low because they've gone through everything and realized that it really was the hormone levels that were low. Someone did send me a private message asking about if we talking about the female side. I guess we'll have to have someone from her care, really, because I guess because you have never done the her care side, right? Because they wanted to go more into the how the female treatment, like females who are dealing with hormone imbalance as well and all that. So we might just so we don't wing it. We'll probably have to
let's not.
Yes.
But I think the process is pretty much the same. Simple process, but but again, any questions, haircare.com for more answers.
And then just call and get get answers from there as well, and all of that. So lowtcenter.com. That's where you'd go, find a location close to you, and then you can always call up and somebody will answer questions and then make that appointment to find out more. Man of few words. Well, there you have it, guys. So, we don't have to have a very long show to educate you. This is a topic that is very needed in every community, not just my community. Every single community needs to know about testosterone replacement therapy, TRT, because it's something, like you said, it's in some communities, it's a stigma to talk about it. You can't be talking about these things in public. But we really, I really wanted, after, engaging in this, I started working here in June, and, I realized that this was something that even for me, I got educated a lot by working here. And I just realized that men's health is in the back burner and it needs to be put in the limelight. So that's why this topic was very important to have a conversation. Like I said, we don't have to do an hour show in order to talk about this. So hopefully we educated some people. If you have more questions, drop it in the comments, send me a private message. We can talk some more about it, and I can answer questions the best way we can. But I thought it was very timely for us to have this. So we thank you, Nelson, for being here.
Thanks for having me.
And thank you so much. And if you haven't yet subscribed to the channel, please go ahead and subscribe, like, share, and thank you again for watching the Saaghe Fogwe podcast.
Thank you.